everyone. Welcome back to the Miraculous Mamas podcast. I'm your host, Elizabeth Joy, and we believe in empowering people through storytelling and education. If you missed last week, make sure that you go back and listen to Megan, our awesome miraculous mama who came on to share her daughter's journey with us with type 1 diabetes. And I apologize because I think in the intro and outro I said type 2, and she has type 1. And I was listening back and I'm like, oh my gosh, Liz, come on. I'm going to say it's a pregnancy brain moment. Mom brain, pregnancy brain, all mixed into one. But it was super interesting. I learned a lot that I did not know. And I think it's really important for people to listen to get educated on, because it really is something that can happen that can happen to anybody. Today, I'm really excited for our podcast. I have on Dr. Sterling, and she is an OBGYN and gives pregnancy advice. She has 2 kids. She's pregnant with her 3rd. I've been following her on Instagram for a long time, and she's hilarious. She's hilarious. She keeps everything real and down to earth. And the thing that I really love about her is how validating she is. I feel like sometimes in the healthcare industry, it's easy to feel that certain things are being dismissed when we feel like they're big deals for us, especially when it comes to pregnancy. It's like, oh, it's fine. You'll be fine. You can't be this sick or that tired, or you'll get over it. And the thing that I love about her is just that she's so validating and understanding, and helps you feel that way, that you are being heard, and that it matters how you're feeling when you're pregnant, and a mom is really important, and that it matters. Today we just have a really fun conversation, and I'm super excited to dive into it. So we're going to go ahead and start the interview. All right, everyone, I have Dr. Sterling here, and she's an OBGYN that I've been following on Instagram for quite a while. Because she just puts out a lot of great information and content. Plus, she's freaking hilarious to follow. Her reels crack me up because they're funny, but then they're also true. So I just am super excited to have a conversation with you today. So thank you so much for coming on the podcast, Dr. Sterling.
Oh, thank you for having me. I'm really excited to be here.
I'd love to talk about first of all, what made you want to become an OB-GYN, and then how did you get into what you're doing now?
Yeah. Well, it's funny. I started medical school and I thought I was going to be an orthopedic surgeon because I come from a family of physicians and we had a few orthopedic surgeons, and that what I realized quickly is that my personality was definitely not that of a orthopedic surgeon. I just really, like, the OBGYNs were my people. And what I love about OBGYN is that you're always an advocate. And I have a strong sense of, right and wrong and justice, and very much want to stand up for the underdog, and women in many cases are the underdog. And so as an OBGYN, you're just always advocating for your patients. Other specialties, other physicians get very scared about treating people in pregnancy, and oftentimes pregnant people are denied a lot of healthcare that they need. And so, in residency, you're spending a lot of the time advocating for your patients to get what they deserve. And that's just that's what I love to do.
Mm-hmm. Yeah, that's awesome. I feel like being in the birthing field, you have to have some aspect of advocacy, totally. Or a heart for that, because it's so vast, right? I work as a birth doula, and there's a lot of stereotypes and misconceptions about them too. And I'm like, birth is not one way. There is not one way. Any way that you have a baby is completely valid. The important thing is that you feel validated and heard throughout your journey.
100%. Yeah.
And so I feel like there has to be some sense of that. And it's really cool because you kind of see some of the old school people that only practice one way. And then you see people like yourself coming in and bringing a lot of reassurance to the pregnant people these days. Yeah,
completely. It's the field is just like the whole world is changing. The field of obstetrics and gynecology is going through some really major shifts, and it's really, really needed. But And I wish it was happening sooner and faster. I'm impatient. That's part of the reason why I left clinical practice, is because the rate of change was a little bit too slow for me. And I wanted to start impacting that change and helping people right away. And if the current medical system, at least in the United States, is pretty constraining in that way.
Mm-hmm. I'd love for you to talk about, I guess we're kind of already on the subject, like what part of your journey like led you into wanting to care for pregnant people, like taking that a step further than what the current like medical climate is doing?
It was very much my own experience. Before I had gone through pregnancy and birth and postpartum myself, I didn't see the holes. I didn't see the problems as clearly. With my first pregnancy, I had a really terrible first trimester. I was on 3 different prescription medications. I was fatigued, nauseous, and I was at a brand new job. So I was working 50 to 60 hours a week. And I was going to the people that I worked with, and they weren't really understanding how difficult it was. And I wasn't really seeing anywhere a representation of my pregnancy experience out there in the world. And I had flashes of saying to people before I had experienced it myself, when they said, I'm really nauseous, I'm just so tired. I had flashes of myself saying, like, reassuring them, like, okay, that's normal. Like, here's some things we can do, but not really understanding the emotional impact of what that person was going through. And for me, people deserve support for both aspects of the journey, both the physical experience of being pregnant and growing a baby and all the potential complications that arise. So we deserve support for the physical and the emotional. They're really one and the same. And I looked around really at our research and our data that keeps showing us that, we know that stress impacts our health. We know that it impacts fetal development. We know that depression and anxiety impact our health. They impact fetal development. We know that loneliness impacts health. And I think all of the research, all of the data, what we're learning, which we many cultures, already knew, is that your emotions and how your all well-being, that matters for your pregnancy too. And our Western medical culture is very much physical is more important than emotional. And we see that a lot. And I think that we're missing it. We're missing a lot of what we could be doing to improve pregnancy outcomes and take care of pregnant people.
Mm-hmm. Yeah, that makes sense. And I remember seeing you post something about like the morning sickness and the nausea, and basically being like, no, it really is that bad. Like, you deserve to be believed. And I feel like so many people are brushed off because it's like, yeah, we get it. Like, yeah, you're sick. Even if you have hyperemesis or whatever, like, it's like, yeah, it's really bad. But I feel like as a pregnant person, you're expected to just keep going on like nothing's bothering you.
100%. And it's what I found so, such a trip was that people were so understanding when I was visibly pregnant. And the end of my pregnancies are not the most challenging part for me. It's always, the first trimester is always the worst, and part of the second trimester too. And it was, it's all about, we don't see we think that like, oh, everybody does it. So it's just like, be quiet, move on. People minimize when pregnant people complain. People are constantly being minimized. Oh, well, you'll get through it. It's worth it. At least you can get pregnant. Oh, don't complain now. Just wait until you're 9 months pregnant. And that is just, it's really frustrating. It is really, not for everyone, but for a lot of us, it is really, really hard. And it is the emotional impact of just feeling awful for months and not being able to escape this body that just does not feel right. I mean, it really hits you on a very deep level.
Mm-hmm. Yeah. I feel like just that validation in the moment is so important. And I've talked about the just wait on here on the podcast before, because that's like one of my biggest pet peeves. And I apologize if I've ever said that to anybody.
I know, right?
Because for me, it was like the postpartum part that was really hard for me. And people being like, oh, well, just wait until you're chasing them around and you blah, blah, blah. And I'm like, listen, I don't feel like I can get out of bed today, like with an infant. I can't even think about a year from now. Like, I didn't feel validated or heard in my experience.
It's the worst. I honestly think it's one of the worst things you can say to somebody who's struggling. I remember very clearly, I think Celeste was 3 weeks old. Celeste was my first. And I had a friend over, and I was saying, I'm really like, this is really hard. I'm really struggling. And she said, just wait until they're toddler. Like, actually, newborns are super easy. And my whole spirit just like dropped. Mm-hmm. I was just like, wait, that was like the last thing I could hear. I just didn't have and I was so sleep deprived. I didn't have the emotional, like, or the perspective of this is just one person saying this. It was like, suddenly that became my reality in that moment. And it was devastating.
Yeah. It's like, oh, this is going to get much worse for you, sweetie. Like, that's what it sounds like.
Yeah. Yeah.
Mm-hmm. Yeah. No, I totally agree with that. And it still annoys me sometimes too, because I'm pregnant with my second, and they're like, I have a 1-year-old and I'm pregnant again. And people are like, oh, just wait, blah, blah, blah. And I'm like, I know it's going to be hard. Okay.
But you know what? The thing is that, yes, it's good. It's all hard, right? But we do figure it out. Mm-hmm. We figure it out. Right. And so, but the warnings are not as helpful as people think they are. Right.
Not at all. I'd love for you to answer this question. How are you feeling today? If the answer is anything less than great, it's time to learn more about your body and to take control of your health. And a great way to do that is the Everlywell at-home lab test. Everlywell offers affordable at-home lab tests that give you trusted physician-reviewed results, including food sensitivity, metabolism, sleep and stress, thyroid, chemical. They have tons of things on there. And here's how it works. They ship the test straight to you and give you everything that you need to collect this type of sample that they need. You return the test to the CLIA certified lab with a prepaid shipping label, and then your physician-reviewed results and insights are sent to your device in just days. I recently just did a food sensitivity test. I don't know if you remember, I did one a couple years ago, and eliminating those foods really helped me. And now I'm back to just kind of eating whatever, and I'm having some digestive issues again. So I'm like, it's time to see what's going on, if I still have the same food allergies or insensitivities, or if I have new ones, because those things can change. So I haven't got my results yet back, but I'm super excited to see what it is so that I can help support my body and my gut to feel my absolute best. And for listeners of the show, Everlywell is offering a special discount of 20% off an at-home lab test at everlywell.com/mamas. That's everlywell.com/mamas for 20% off your at-home lab test, everlywell.com/mamas. Now back to the episode. So you have an awesome program called the Sterling Parents, and I would love for you to just kind of tell us how you started that and what that is all about.
Yeah, so I left my clinical practice in 2019 and really dreamed of providing everything that is missing from our current prenatal care and postpartum care, certainly. And I'm doing so in an online space, because the way that I looked at it, I said, prenatal care is not meeting the needs of most people. There's not enough time for education, like proper education about people's options and what different things mean. A lot of people aren't feeling heard in their prenatal care appointments. These appointments are 10 minutes. It's very difficult to fit in what someone, a robust explanation of what's happening in their pregnancy into 10 minutes, in addition to all the other things. So I knew that there was an education piece that was missing, and people were going to Google, and that was just increasing their anxiety because there's so many different sources of pregnancy information. So I really wanted to, be able to provide good education for people for their pregnancy, answer their questions in a way that they understand and from a person that they trust, and also provide that emotional support as they move through the reproductive journey from trying to conceive, pregnancy, postpartum, and beyond. Now, in order to do that in person in a medical office, I wouldn't be able to take insurance. It would be a cash-only practice. It would be, I wouldn't be able to serve many people, and it would only be people who could afford that very expensive type of medical care. And that type of medical care is actually booming right now. That's concierge medicine. In big cities, there's a ton of it. Mm-hmm. And people are actually getting really good health care, but they're paying tens of thousands of dollars a year in order to just get baseline access to that. And so I knew that was not going to serve my mission. I wanted to help more people, not less. And I wanted to do so in a way that was affordable for most people. And so I created this online platform called Sterling Parents, where people have access to me. So we meet on Zoom. I add them to my close friends on Instagram. So they have access to me to answer their questions. And I'm able to educate them about things that, their provider may have said, oh, we need to do non-stress testing. And then I get a message from them, or I meet with them on Zoom and they're like, what does that mean? Why is that done? And I can explain what that is. Mm-hmm. So it's just that added layer of education. And then we have a database that they can access 24/7 with, tons of Q&As about, all your pregnancy questions. And I love making educational videos. So we have educational videos about GBS, about, insomnia in pregnancy, about nausea, about genetic screening options, like everything that you want more information on. I can go, especially for people who really like to know the why and to understand what's happening. That's what I like to explain. Mm-hmm. So that's what the platform is all about. And we also reinforce 9 skills, teach 9 skills that we believe are really important to both have during the reproductive journey and as parents, because that's also something that I feel like is really missing from this pregnancy, mm-hmm. Prenatal care and pregnancy journey is we're not just growing a baby, we're growing a parent. Yeah. And that parent really needs resources so that they can not only be the parent they want to be, but actually enjoy it. Mm-hmm. Because parenting is really challenging these days. And we're again, it's the information overwhelm. And we're not really being taught how to lean into our strengths as a parent and mm-hmm. lean into, our intuition. It's all about doing it the right way.
Right. Yeah. I love that. Cause I feel like even as a doula, like going through my first pregnancy, like things that I would normally tell somebody like, oh, this is normal or this is fine. I found myself like Googling and being like, wait a second. And just kind of diving more into some of the other stuff. And I am a huge a huge advocate for I really believe knowledge is power, especially in the reproductive and pregnancy and birthing journey. Because I feel like the more information you have, then you're not blindsided in the moment. That's why I encourage anybody who does a birth plan, look up C-sections, look up these things, have a plan for each thing.
100%.
So that when it happens, it's not this just wasn't going to happen. It's no, you have a plan for it. And
I can't tell you how many people are oh, I just skipped the chapter on C-sections, just skipped over it because that wasn't my plan. And I think that really contributes to some of the trauma that people can experience for sure. Oh,
for sure. I feel like most first-time moms don't plan on going in having a cesarean birth, but things happen and they're there for a reason. So, I think that it's great to at least know about it, and have some tools in your pocket. But like you said, the information overload, 'cause I found myself, I knew tons about birth, but when it came to me taking this tiny human home, I'm I don't know what to do with this baby now. How do I survive? And I'm one of those people that loves the research. And so, I took so many courses. I took I had to take a breastfeeding course for my doula certification, but I'm that was a few years ago. I'm taking a new course, 'cause now I also have a different perspective on it. sleep, whatever, everything that's out there. But I also found myself being so overwhelmed because I'm like, well, this thing says that I need to do this, but this thing says I need to do that. But neither one is taking into consideration like my baby's temperament, my temperament, our life, like what it's like. And it was just so much information that I found it really hard to know what the right thing to do was.
Right. And I think that part of it, as especially those of us who are millennials or who are millennial adjacent, we really came of age. We really became adults when handheld devices started being ubiquitous and everywhere. And so we learned how to be adults with the internet and with our phones. And so we looked up everything that we needed to figure out, right? Like I remember the first time I packed for I was going on my honeymoon with my husband, and I was going to travel internationally for the first time, as an adult. And I was like, all right, what do I pack? Let me go onto the travel blogs and let me ask the experts what I need to pack. I didn't sit there and try to figure it out myself. It was always, it's this habit of let me go consult the expert. And because there's so much expertise online, there's also a lot of non-expertise online, but still, but we just get into this habit of okay, somebody out there has the right answer. And if I just sort through enough information on the internet, I will arrive at the right answer. And I think that I love education and expertise, and I love people sharing it, but sometimes we need to start with ourselves and not have the first place we go be the internet. I think it's much easier if we ask ourselves some of these questions first. What do I think is right for my breastfeeding journey? Okay. This is what feels right to me, but I'm missing this piece of information, and I'm going to go look for this piece of information from a few trusted sources and then make my decision based on that, instead of just going and just accumulating we try to bring in all of the data. There's just too much data. There's too much information to gather it all and then sort through it.
Right. And if anybody's like me at all, I feel like I would read and read and read on different things. And then I almost wouldn't stop until I found the answer I was looking for that felt that I already almost knew, that reaffirmed what I'm okay, well, I think we should do this with her. This article says no, this says no. Okay, this article says, yes, that's okay. And it's already that I was kind of already leaning toward this way, but I needed the information to tell me it was okay.
Yeah. 100. We're looking for reassurance. We're looking for, and I think, as, now as I'm working on baby number 3, I have been able to understand that I can trust my instincts when it comes to parenting, or my intuition. I mean, I don't always know the answer right away, but I can ask myself the question and come up with what I think is what I feel comfortable with. But that's something that I had to practice. It's not something that just arrived I gave birth, and this trust in myself to make these decisions just came with it, even though we kind of make it seem like it's going to, right? We're a mother's instincts, a mother's intuition, you'll just know. And I did not just know. That was a skill. I mean, that's a skill that's one of the 9 skills that we work on. And we talk about intuition inside of Sterling Parents, is because what is intuition? What do people mean? A lot of people get confused between fear and anxiety and intuition. And so that's a conversation that we have about what are the actual practices that you can do in your daily life to build that trust and to build that intuition, because parenting is much easier when the first time, when you have that, okay, I want to do this, and you can trust it and go with it. And also know that it's all an experiment. It's all trial and error. There's a lot of wonderful parenting experts out there, but their advice does not work in every situation.
Right.
It doesn't, every child is different, and it's the dyad, it's the parent and the child and the two personalities together. and not all of the scripts work for those two personalities, you know?
Mm-hmm. Yeah. Yeah. I love how you worded that. We're going to take a break from this episode to talk about taking control of our mental health. You all know that I'm a big fan of BetterHelp, and I just want to share them with you again because it is so important to have no shame and to feel empowered to take control of your mental health. It doesn't mean that you are really depressed in order to get counseling. It doesn't mean that it's not the same cliches that maybe were there in the past. And maybe you are really depressed, and that's okay. Talking to somebody can help. And the thing that I love about BetterHelp is that you get to connect in a safe and private online environment that's convenient. They help pair you with the right counselor, and you can send a message to them at any time and get timely and thoughtful responses. BetterHelp, they're committed to a great therapeutic match for you so that they make it easy and free to change counselors if you ever need. And everything you share is always confidential. It's convenient, professional, affordable, and you can check out the testimonials that are daily on their site. And in fact, so many people are using BetterHelp that they're recruiting additional counselors in all 50 states right now. Start living your best life today by going to betterhelp.com/mamas to get 10% off your first month. Join over 1 million people taking charge of their mental health. Again, that's BetterHelp, HELP.com/mamas. I always feel like one thing that I tell people after they have a baby, I'm like, just keep in mind, you guys are getting to know each other. Like you as much, I mean, there are people that like have a baby and feel this immediate connection. I did not. I thought I would. I've always wanted to be a mom, you know, like I'm going to bring this human into the world and just have this overwhelming love and connection. Yeah. And that came months later. But I'm like, your baby is literally trying to figure out how to eat outside the womb. Like, and what is day and night? And like, they're trying to figure out like, what is this world I just got into? And you're trying to figure out like, how do I keep this human alive? Like you have to give yourself so much grace during that period of getting to know each other. And then when you get to know your kid, they change, right? Like their personality starts 100%. Coming out.
Yeah. Yeah. This idea that like adults, and parents are like, you know, we have this, and this is an older idea that I think is evolving, this idea that the parents are kind of like up here, they're up on a different level than their children. And they're the ones who know better and who, you know, have it figured out. And then we're just teaching down to our children and helping them come up to our level. And that's just, I mean, that's just not the reality, right? Mm-hmm. What's actually happening is that we are learning from our children and they are learning from us. We are two beings of equal value that have, I mean, we learn so much from our children and they learn from us. And it's a very much, we are on an equal playing field in terms of learning. Like they're trying to figure out things that we've long since known. We know how to put a fork to our mouth and we know how to walk, but we are still each, you know, there is always more evolution and growth to be had. And so we are ahead in some ways and not ahead in others.
Yeah, that's so true. That's so good. And I'm glad that there's people who talk about that now, because I feel like that's not something. I remember just having conversations with my mom and she's like, there's so much that I wish I would have known back then. Like you expect a kid to act perfectly all the time. Whereas like they're humans too. Sometimes people wake up on the wrong side of the bed. Don't you ever just have an off day? Don't you have days where you're more hungry or days where you're less hungry or days where you're just irritable? Like a kid is a human. They're of equal value. Like they're going to have that too. And just like, I feel like it's great, like having that information to remind you on those days where you're like, you know what, maybe they're just having an off day and that's okay. And not expecting them to act perfectly all the time. Cause I mean, we don't, right? Yeah. Certainly not. I lost it last night because my husband told me that we needed to get rid of all of our Tupperware. And I'm like, I need Joey to play with it to distract her while I cook dinner. He's like, okay. I'm like, I'm sorry. I just really need it as a distraction. Okay.
Do not throw it away.
I'm like, you do not understand. He was like, dude, you just like went off. And I'm like, I know.
it's a sore subject.
Right. I'm a human and dinner time's really tough. So I need that Tupperware in that cupboard to get through it. But yeah, I mean, it is really great to have that information. I'd love to talk about, as an OBGYN, like what are some myths that you get about your profession? Cause I feel like every profession kind of has some like, either like myths or even things that people didn't know that you could do.
I mean, there's a lot with OBGYN. I think in general, the unfortunate thing is that I think people, our appointments, especially for obstetrics, are pretty short, right? They're 10 minutes. I think people genuinely think that OBGYNs that we do that because we want to have short appointments, and then we want to like be in a hurry. And the reality is that pretty much like any doctor you talk to, if you're like, hey, would you want to see 30 patients for 10 minutes a day? Or would you want to see 10 patients for 30 minutes at a time? Everybody's going to choose the 10 patients. Like nobody wants to work. We don't want to work this way. This is a reality because of what insurance pays. And so we are all trapped in this system, this healthcare system. And people, I think there's this idea that I think that OBGYNs and patients are both suffering in this system. OBGYNs, it doesn't feel good. I mean, we all, for the most part, all of us went into medicine to help people and to have that human connection. And when you are seeing 30 patients in a day, and you have a patient who has a miscarriage, and you have to tell somebody they have cancer, and you have a person who comes in and needs to be tested for STIs because they found out their partner was cheating on them. I mean, it's very emotionally heavy. And truthfully, to continue on and do this for decades, I made it 3 years. To do this for decades, you have to separate yourself a bit. And it's really unfortunate because you can't separate yourself all the time, but there's a compassion fatigue. And so certain, like the everyday stuff, like the everyday, I'm feeling really nauseous and fatigued, doesn't necessarily meet the parameter where you're going to like break through and emotionally connect with that person, because your parameter is now like, okay, if you have cancer or you've had a miscarriage or like, you know what I mean? Like there's just this, you have to protect yourself in a way. So, but it doesn't feel good to do that. For most OBGYNs most OBGYNs don't love their job. I'll tell you this. Like most people are really struggling with it. There's a lot of trauma that happens in OBGYN. There's a lot of, especially obstetrics, there's a lot of life-threatening emergencies that I was just talking with a girlfriend this past weekend. She's looking at me and she's like, I'm getting to the place where you were a few years ago. I don't know if I can continue doing this. Like I'm crying every time I drive home, because I've had some bad cases and I can't let go of the trauma. Every time something bad happens to a patient, it feels like it's happening personally to me. And yeah, it's, I think that, OBGYNs are very, very human, very much human beings. And I think we're all really suffering in a way in this medical system that puts profits above human beings. And it's tough.
Yeah. I feel like that's a problem that you see a lot more in the United States than in other places where healthcare is much more accessible and things like that. I feel like here it's kind of all about the money with all of that stuff.
Yeah. I mean, it's definitely, it's different in other countries. I mean, I have parents from all over the world in my community, and the profit here is definitely a problem, but there's, even with universal healthcare, they have to limit appointments in a different way, right? Because the government is paying for it and they have to pay for it for everybody. And so it's a different flavor of the same problem. And yeah, I mean, the reality is that if you have money and you can pay cash and you don't have to rely on insurance in this country, and even in other countries where you can get supplemental insurance, you just have a better experience.
Yeah. Yeah, that's so tough. So what about things that maybe aren't outside your realm that people think that they can or they don't go to you for? Because I know like a lot of times people think maybe it's just during the reproductive years or whatever, or only if they need birth control that they're going to come to you.
I mean, there's OBGYNs do a lot. So first, we are surgeons as well. And so people with, ovarian cysts, heavy uterine bleeding, vulvar, precancers. I mean, all of these things are part of our wheelhouse. There are some of the disorders that people don't come to an OBGYN for that I really wish they would are mostly the like low libido, hypoactive sexual desire disorder. That's the stuff that, most women or most people don't bring to their health provider's attention. Maybe they had a bad experience when they brought it up before. Maybe they're embarrassed about it. Maybe they don't realize that there's things that we can do. I think the other thing to keep in mind too is that even within OBGYNs, there's a lot of subspecialists. Some people are really good at pelvic pain and that's their subspecialty is pelvic pain. And if you're having pelvic pain and you go to an OBGYN and you're just not, I mean, I hear this all the time for people with endometriosis or really, painful periods. They'll go to one OBGYN and will not really get the support they need. But the OBGYN down the street, like that's their passion. That's their bread and butter. And they're really going to take great care of them. This is because it's such a broad specialty. There's so much that falls under our area of expertise. We are getting more and more subspecialized. And, if you go to an OBGYN who's really all about robotic surgery and doing complex surgeries, but you're pregnant, they may be seeing you because they have to see pregnant patients, because that's where a lot of the money comes from in their practice, but that might not be their thing. Right. So we all have different things. So it's good to, when you call up and, you go online, they're going to list like all of the things. It's like the things that they're an expert in. But I think it's completely, you can call an office or have an introductory meeting with an OBGYN and say, what's your thing? Like, what are you really great at treating? Because we're not all great at the same things.
Yeah. I remember hearing that before from like a pediatrician. They were saying that you all have like the same base learning, but it's the continued learning after that, what you're passionate about, the field that you're like, wow, I really want to help people with this problem.
Exactly.
And I mean, that seems like that would be the same across the board with all healthcare providers.
Yeah, you cannot keep up to date on all of the research and literature. It's just, there's no way I could keep up to date on all of the different things in obstetrics and gynecology. There's not enough hours in the day. So I focus all of my continuing education that I focus on is really obstetrics and then just like basic well person care. All of the, I have friends who are pelvic floor specialists and that's the data that they keep up on. You have to pick.
Right. So I have a couple of birthing questions for you. Have you ever seen a complete placenta previa ever resolve itself throughout someone's pregnancy?
Yes.
I had somebody asking about that.
Depends on how early it's diagnosed.
Right.
I've never seen one diagnosed at 28 weeks resolve,
right,
that I've seen one diagnosed at 12 weeks resolve.
mm-hmm.
So the earlier it's diagnosed, the higher the chances. Most previas diagnosed like in the first trimester will resolve.
Mm-hmm. Yeah. Yeah, I had somebody asking me about that because I honestly, I've never even had a client that had a previa. So I'm like, I don't know the answer to that. But yeah, I feel like there's certain situations that there's things that are out of your control, right? There's nothing you can do to prevent that.
There's nothing you can do. There's nothing you can do to prevent that. And there's nothing you can do once you get it. Mm-hmm. I mean, it is really, that is placenta is baby's tissue. It's not yours. You are not in control of it at all. I mean, there's a lot in pregnancy you're not in control of, unfortunately.
Right. And I feel like that's the hard thing that there is, I guess, like for a lot of people. Let's just touch on that really quick. Cause I know like even you could do everything right? You can have the most healthy pregnancy, do everything right. And there's still certain things that can happen. Like preeclampsia can still happen. Yeah.
I mean, preeclampsia, these blood pressure disorders of pregnancy, if you look at the numbers, you think, okay, it's like less than 10% of people, experience this. It's a lot of freaking people. Okay. Yeah. Like that's why, statistics can be very deceiving. Mm-hmm. So a problem that affects 1% of people is impacting a lot of people when you're looking at the entire population of pregnant people, right? So yeah, I mean, the thing that I think is so important for people to understand is that pregnancy, yes, takes your health, your genetics, your body into consideration in terms of risks of different things. But there is another person with their own genetics, with their own, they have their own placenta. And a lot of the things that are happening in pregnancy are about in the interaction between the two and also just the genetics of that baby. For example, one of the risk factors for preeclampsia is not if your mom had preeclampsia, that's a risk factor, but also if your partner or the sperm donor, or whoever, however you got that other chromosome, if their mother had preeclampsia. So it is not just about us. It's about, and we are learning so much about the placenta and its impact, even its potential impact on things like postpartum depression. So maybe postpartum, yes, we know that there are genetic, there are genes that are associated with postpartum depression. There are genetic factors that are associated with postpartum depression. But we can even look at the placenta, and there's some data that, okay, if we look at the level of this hormone that's being secreted by the placenta, if we look at that at 28 weeks, if it's higher, those people are more likely to experience postpartum depression.
That's crazy.
So much is out of our control. And so it's a balance. I think that what we have to understand is it's a balance between let's do everything that we can within reason to ensure that we're having a healthy and emotionally well pregnancy. But at the end of the day, you can do absolutely everything, quote unquote, right, and still end up with a complication. These things are not an individual's fault.
Right. I know. It's so hard because I feel like that's kind of the beginning of learning that you're out of control, like that you don't have control.
100%.
And then you have this baby. I know for me, I was like, this baby relies on me for life. But there's so many things out of my control. Like I'm doing everything I can to like help this baby, but what if this happens? Like your mind starts going crazy. And I feel like pregnancy is kind of like that first step of trying to do everything right. But that's another thing with the birth plan. I like to say it's a wish. Let's just have some wishes because things don't go as planned. Like even if everything went the way you thought in your mind it would, emotionally it may not have. Physically it felt different. Like you can't prepare.
100 times yes. I mean, we actually just had last night, we got together on Zoom with the Sterling parents and we had a guest expert, and the entire topic of our discussion was embracing imperfection because it pops up it pops up from the very beginning in our reproductive journey. I mean, my birth is the exact, it was so meant for me because it was so the message that I had to spread to other people. I had the birth that they show in the birth classes. I had the tub, the flickering LED candles, the spa music. Everybody, my doula, my husband, the midwife, all thought that I had fallen asleep. But in reality, I was not asleep. I was in so much pain that I couldn't communicate and I couldn't move. Mm-hmm. It was a quote unquote perfect birth that got all of my wishes. Every single checkbox occurred, and it was incredibly traumatizing. Yeah. And like still to this day, it's very hard for me to talk about. Mm-hmm. Fast forward to my son's birth, which was, I ruptured my membranes before the onset of labor. I was induced. I had an epidural. He was 10 pounds. It was a beautiful birth experience. I was laughing as I pushed out this 10-pound baby. Yeah. So, it was everything that I was afraid of with my first birth happened. Yeah. Mm-hmm. And so it's just like, it can all go right. Mm-hmm. It can all go right. And it can be not the experience you had hoped for.
Mm-hmm. Right. And that's like something that I tell people too, because like things that I would say as a doula, like I did them all, right? And even to try to make sure that the baby was like in the perfect position, I was doing all the spinning baby positions and all these different things. And she was sunny side up. She was ace in clinic. I had a super long, very hard labor. And I think it was around like 8 centimeters. I ended up getting an epidural. And I was like, why doesn't everybody get this? This is the best thing ever. But I was completely out of it. I was so exhausted from labor and then she ended up in the NICU for a week. So there's just like a lot that you can't plan for. We didn't plan for that, but then I was glad that I knew about epidurals. I knew about the different things that were taking place because I had studied and learned about it. So I wasn't afraid. I always knew it was an option. And I wasn't so in my head that like, no, this can't happen because I'm like, I've seen it work beautifully as a tool. Some people need it in order to relax, to let the baby finish coming out. Like it can be an amazing tool. And that's part of trusting your intuition as well. I feel like or even your providers, hey, maybe we should try this thing.
Well, here's the thing. People always talk about epidurals and like intervention in birth as being unnatural, like the quote unquote natural birth. And it always cracks me up because what's the most natural thing in the world for human beings to do? Use freaking tools. We use them all day long. We couldn't survive without them. So personally to me, I have had a intervention-free labor, and I've had a labor that was heavy in intervention. To me, they were both beautifully natural because human beings use tools, and it doesn't make it unnatural to me.
Right? Yeah. I don't love the word natural and unnatural birth. I'm like, birth is very natural. But I feel like it's great to have what you want, but it's also great to know that you have options. As well. And then I'd love to just touch on before we wrap up, just choosing the right healthcare providers for you. Because I feel like that can be hard for some people. Because that's something that I always tell too, is like, if you don't jive with somebody, like even if you want to hire me as a doula, I'm like, interview other people. Like you have to go with who you feel, if we don't jive, we don't jive. But same with providers, like just because you've gone to this person your whole life, that might not be who you want as part of your birth team. And that doesn't mean it doesn't have to mean anything. It just be you want somebody different for your birthing team.
We're people, right? There's people that it is impossible as a provider to fit the needs of every different person, and I think it's important to go where you feel it's really easy to know if it's really wrong or if it's really right, but it's it's the in the middle, the people who are like, I'm not sure, and at the end of the day, you may be limited. If you live in a big city, you've got tons of choices. If you live in a small town, you have less. But I think that the important thing is to, when you're trying to decide, okay, is this person right for me, is always, if you aren't jiving with something, always give that person an opportunity, if it's not completely egregious, to understand what you want. And, if you're feeling like, okay, I feel like I'm not being heard, to think about it and get as specific about, okay, what is it that's making me not feel heard? Is it a lack of eye contact? Is it that they're telling me that something is normal and giving me reassurance when what I want is action? Like, get really nitty gritty about why you're not feeling it with that provider. And then talk to them like any other human being and say, sometimes in our appointments, I feel like I'm trying to talk to you and I'm trying to make eye contact with you. And I don't get that back. And it makes me feel that maybe you're not hearing me, or maybe you don't care about me in the way that I would really like to be cared about and heard. Or, when I bring up some things, you tell me it's normal and you give me reassurance, and that's great, but I really want something to be done about it. And, give people an opportunity to either react poorly and get defensive. And then you have like, oh, whoa, like this is, if somebody is reacting, poorly and getting defensive, that's a good sign that maybe that's not a good fit for you. But it also may be somebody has really not realized that that's what you need from them. Mm-hmm. Because people need different things from their providers. Some people really want a lot of education and really want to talk through everything. And other people are just like, you start talking about a subject and their eyes just glaze over and you're like, okay, I'm boring this patient. Like, this patient does not want this information from me.
Right. Yeah.
Every patient, we kind of assume that like, oh, everybody's going to want the same things out of a provider that I do. Everybody wants their provider to talk to them while they're doing a pelvic exam. Every person doesn't want them to talk to them while doing a pelvic exam. There is such a huge spectrum in what people want. So just telling them can be really helpful.
Mm-hmm. Yeah, that's good. And then I have one more question before we wrap up. Because you said that you had a doula at your birth. And I think that sometimes there's also this like misconception. Well, as a doula, a lot of people don't understand my role or what I do. People think, oh, you deliver babies at home. I'm like, no, I do not deliver babies. I don't want to deliver babies. I don't have any training to deliver babies.
Yeah.
But I think that there's also kind of a lot of people think like we're on opposing sides.
For sure.
Right.
Mm-hmm.
So I'd love for you just to kind of speak to that.
So to me, listen, I know that every OBGYN has a doula horror story.
Oh, I'm sure.
I mean, we've all got them, right? But I hope that the majority of good OBGYNs realize that in the majority of cases, this is really, and the data supports this as well. This is a huge asset for your patient. This is really helpful for your patient to have. Mm-hmm. Because as an OBGYN, if you're taking insurance, you really can't spend an entire labor with somebody. That's just not feasible. But continuous labor support has great data to support its benefits, right? So to me, it's always a red flag when an OBGYN is just completely against doulas. Like, I'm fine hearing your one story about the crazy doula that was doing like really weird stuff. Like, I will laugh with that story with you, but you then deciding like doulas are bad when that's not what the data shows us. And when, if you have that attitude about doulas, obviously you're not going to be jiving with them. If you come at it with, we are against each other. And the same thing goes for doulas too.
Oh, for
like,
sure.
If you have a doula who is creating an adversarial relationship with your provider, that does not, it's not helpful either, So I think that, it's a red flag on either side if you see the other as an enemy. And there are certainly not great OBGYNs out there that people need to stand up to and say, and, advocate for their client to have informed consent and those types of things. But, most of the time we work so much better together. Mm-hmm. And I have had such great relationships, with doulas because they are able to provide something to my patients that I cannot provide.
Yeah. Mm-hmm. I feel like I was at a birth where the nurse had to have had like a bad story before or something, because at the end of the birth, she was like, I just want to say thank you for letting me do my job. And I was like, I don't know how to do your job. Like, I didn't go to nursing school. I don't know any of this, but I'm like, I feel like, cause she was kind of cold to me throughout the birth, but I'm like, whatever, I'm here for the client.
Yeah.
And afterwards she was just like, hey, thank you, like, for staying out of my way and letting me do my job. And I'm like, she must have had somebody who was like in here trying to, like, I don't know, do something or tell her how to do her job. When we have completely different trainings, and that's the thing. It's like
trainings. Yeah.
Right. So I feel like I'm sure, there's horror stories on both sides. And I like how you said that too, because I feel like I've had people reach out to me and be like, I really like the way that you talk about how doula should be. Like, I hired one for my birth and they sat in the corner and knitted the whole time and wasn't there for me. And I'm like, what? I'm like, I'm so sorry you had that experience. Like, that is not at all what we are trained to do. And like, I'm so sorry that you had that experience. If you want to hire another one, a different time, make sure you get a lot of references and things like that, because there's going to be bad experiences.
Yeah. Yeah. I mean, there's just, these are human beings, doulas, OBGYNs, midwives, they're human beings, and they have bad days, and some of them are better than others for sure.
Right. And I can't imagine, like, at your job too, if you just came from like a birth where there was a loss or something horrific happened, and then you have to go into this next birth to deliver a baby, just that emotional energy and weight, like, how can you emotionally be there for the next person after that?
Yeah. I mean, I can't tell you the number of times where you are smiling on the outside and crying on the inside. Mm-hmm. Like, it's just, and it is one of the things that we really, in order to make OBGYNs better at our jobs, we need to provide, we need therapy for all of the trauma. My husband's an emergency physician, and he sees really awful stuff too. And we talk about this amongst our friends all the time. All of our friends are, either ER docs or OBGYNs. And we talk about the fact that, like, the old medicine way of just shoving it all down and, is just, it's not sustainable, like, physicians, especially those of us who are in obstetrics and trauma surgery and emergency medicine, these specialties where there's just a lot of trauma. It's, oncology. Like, we need therapy. We need to process the trauma, because otherwise we have to shut off our emotions, and that's not good for us, and it's not good for our patients either.
Mm-hmm. I know. Yeah. I remember when I went to therapy like a couple years ago for not doula related things. In order for insurance to cover it, they have to diagnose you. So she had to diagnose me as depressed in order for my insurance to cover it. And I'm like, I don't have to be depressed to, like, need therapy. I just want to talk to somebody.
It's called preventative.
Right.
Yeah.
I'm like, man. I just want to thank you so much, Dr. Sterling, for coming on and for answering all of my questions. And I'd love for you to just tell everybody, where can they find Sterling Parents, and then where can they follow you on Instagram?
Yes. Well, Sterling Parents is really easy. It's just sterlingparents.com. And that's Sterling, like sterling silver. And then on Instagram, I'm Dr. Sterling OBGYN.
Awesome. And I'll link everything in the show notes for everyone to find you. Thank you again so much for coming on.
Of course. Thank you for having me.
Have a great day. I'm so grateful for my conversation with Dr. Sterling. She's hilarious. Hilarious, but also nurturing and validating. So make sure that you go follow her on Instagram and connect with her, Sterling Parents. She's just such a great resource. Next week, we're having on Deborah, who is an interior designer, but she specializes in vegan and toxin-free living. And she's going to take us through our home, but mainly just focusing on your nursery and your bedroom and changes that you can make to eliminate toxins in your home and also to make the world a little bit of a better place. I learned a lot from her on the furniture industry and how there are humans and animals being harmed in the making. And there's so many changes in the world that we need to make. But it can feel overwhelming, so it's just one thing at a time. But I'm grateful for her coming on because there's definitely a few things that I would like to shift in our home and make a few changes just to make sure that we aren't being exposed to chemicals or supporting industries that are harming people and animals. So make sure you check out next week. And then the week after that is Thanksgiving week, which I'm really excited about. We're going to have an episode on joy with Radha. She comes on and she helps people cultivate joy in their lives. And it was an episode that I needed. I hope you need too. I'm pretty sure I cried. I feel like this season of my life's just been, by season, I feel like moving to Chicago away from everyone I know and love. And then getting married and then becoming a mom and now being pregnant again. I just haven't found my bearings in it all. So it's a great episode, and she has a great free month for everyone to try her awesome program that she developed to help cultivate joy in your life. So make sure that you are staying tuned for that. I love you guys. Make sure that you are subscribed to the podcast, that you share it, and that you reach out to me with episodes that you would love to hear, topics and people. All right. I'll talk to you later. Bye.
If you want to be the most interesting person at the cocktail party, well, hop on over and listen to the Brain Candy podcast.
Our award-winning content will have you laughing while you're learning.
We read all the best articles, books, and studies and keep up with new TV shows, documentaries, and pop culture. And then we cram it all into 2 shows a week.
Conspiracy theories, cannibal rabbits, unsolved mysteries, the history of the Walkman. There's something for everyone.
The Brain Candy podcast. Find our link in the show notes.
Or simply search for the Brain Candy podcast on your podcast app.